One of the major reasons for relationship dysfunction and divorce in our society is love addiction. Love addiction is a serious condition insufficiently understood or challenged by the psychological professions, nor by John Q. Public out there. Individuals suffering from the malady do not fall in love with someone who will return their affection. Rather, they are attracted to somebody who will neglect the relationship, usually causing it to fail. I have Ms. Marla Matthews with me to explain the psychological condition. Hello, Marla.
Hi, how are you, Chris? Nice to be here.
Thank you. I'm glad we acknowledge.
I'm glad I'm here, yes.
She's from the Relationship Journey. Some of the examples that you might be familiar with are, for instance, our audience may remember the example of Clara Harris, who in Houston in 2002, she ran over her husband, the dentist, ran him over several times with a Mercedes-Benz. Or that Lisa Nowak person who was the astronaut, drove 900 miles from Texas to Florida with diapers on, and so that she wouldn't have to stop. And she was armed with a BB gun and pepper spray. These are people that are hung up in their relationships and they can't really do very much about them, right?
Exactly. You just think about the two situations that you stated. A woman driving with diapers on. Before you even get to what happens after that, that's going to speak volumes to the level of she had a complete break from reality. Just the whole thought of doing something like this, you're not in your right state of mind. And that's the key here with love addiction. If you take someone who has an alcohol addiction, a substance addiction, pills, cigarettes, food, eating addiction, people don't eat too much because they're hungry. People don't drink too much because they're thirsty. There are cardiologists that smoke cigarettes. So you need to take away the intellectual, rational component to the personality. And by the way, this is not a personality disorder like someone who's bipolar. Kings, queens, people in high functioning positions otherwise. If someone is I think of the situation with Jean Harris, the Scarsdale killing. Now, here was a very bright woman who was in charge of a school, I believe, and she killed this doctor out of jealousy. But it's much deeper than that. Love addiction has to do with a disconnect from reality, where that person who is otherwise functioning and other levels, on very high levels, when it comes to now this person who is now the object of their obsession, of their fantasy. Just like someone who continues to drink knowing they have liver disease, someone who's in an oxygen chamber who continues to smoke cigarettes. These are clearly...
It's an addictive quality.
It's an addiction. It's not someone who's thinking in a rational mind. It's called addictive thinking. So yes, your open was great in that these crimes of passion, we call them often in our culture. I don't think this issue is addressed, which is why we're doing the show today.
Sure.
The severity, the suicide, the murder, that is all connected and attached to this very serious condition.
Did you just describe some of the signs, or shall we describe some of the signs of love addiction?
Some of the signs of love addiction, and it can start any age. You know, the situation with the Buttafuoco case. I use these cases because then people can get an absolute handle on what we're talking about. That was a young girl, otherwise appeared to be functioning okay in society, and she went and she shot her lover's wife in the face, just went up to the door and shot her. So the signs are people. There really aren't signs, I have to tell you. You could be sitting
these desperate
here,
measures seem to be
but
sometimes.
there are no signs that would show you that this person is leading up to be performing on this level to go and murder someone, other than you see them falling into a situation of depression, anxiety, acting irrational, just not doing the tasks that they've normally done. But again, it's not a psychiatric condition. There are many alcoholics that function at a very high level. There are judges, attorneys that are functioning in high-level positions, and they have serious alcohol conditions. Same here.
How about obsessive behavior? Might that be a qualifying sign?
Not in other areas, only when it comes to the object of their obsession. You know, to that person,
kind of
that fantasy.
then.
Yeah, but in other areas, no, there's not going to be like an OCD, if that's what you're talking about, obsessive-compulsive disorder.
Something
no,
like that.
it's not connected to other
How
situations.
about somebody talking about the subject maybe incessantly?
Yeah, that could be. You could have
hidden drive that
yeah, wherever you meet with this person, they're always mentioning their boyfriend, their husband, their lover, the girlfriend. It seems like whatever situation, oh, that butterfly on the table. Well, did you know my boyfriend loves butterflies? And all of a sudden they're off and running.
On
yes,
butterflies.
exactly, on butterflies, when that's not really what you're there to discuss.
Do you think that there is a personality type that might be more susceptible than another to develop these symptoms?
Yes and no. All of our psychological, our personality is pretty much formed when we're children. And for this person, Pia Mellody does a good work in her book on love addiction. She talks about the person being abandoned as a child, not necessarily physically abandoned, but emotionally abandoned by usually the mother or the father. And they just feel like they're alienated as a child, and then they don't feel the love that they should have gotten with the parent taking care of them. So like everything else, it manifests in childhood. But I think that certain people are more predisposed to this than others, just like alcohol abuse. There's a chemical component to that and predisposition. I think the same with this addiction as well. I think there's a predisposition here too.
This might be, I hope it's not repetitive to the first question. Is there something that people can recognize in themselves or their family should recognize? Some sign, I guess. That's why I was wondering if it's a duplication.
Yes, I think when this thing starts to manifest, the person loses interest in other areas of their life. You know, if they're going to school and their grades are good and all of a sudden their grades are falling and they're just consumed and addicted, just wanting to get that person to be with them. There's a withdrawal that goes through when they can't be around the object of their fantasy. And again, I have to qualify, and I want to discuss this with the audience. This is not, when we call this love addiction, this is not love. Because when you love someone, you know them, first of all. You know who it is you're loving. You care about the person. If you think about the movie Fatal Attraction, she had a very serious love addiction. Now, she didn't love him. It was all about the fantasy of who she created him to be, to take the place of what her father didn't meet for her. They show that in the movie, that her father died when she was a young girl, and she didn't have that parenting figure. So the signs, again, would be there when it comes to if you discuss their relationship with them. But if you're dealing with them in other areas of life, no, you wouldn't see that this person had a problem with that.
Pia Mellody gives the example of possibly daydreaming or conjuring up of fantasies. Might that be?
When they're alone, but not that you would observe with them. But they become very depressed when they're unable to be with that person of their addiction, their fantasy. And when the person becomes a real person and is no longer the fantasy, oftentimes that's when all the chaos comes in, when that person can't accept that that's a real person who has imperfections and is not going to meet all their needs.
How do you describe that love and not love situation a little bit better for the audience? You know, they say that they're in love, or they're acting like what they think they're in love, and that's not love, as you just said a moment ago.
Right. Well, this addiction, one of the signs of this addiction is that these people put magical qualities on other people. Okay, so let's say I just met you and I decided I really wanted to get to know you. I would be assigning qualities to you that I don't know that are real, that exist, because I don't know you. Right, they're magical qualities because, again, it's about the fantasy. That's what it's really about. So when you love someone, first of all, love takes time. When you love someone, you care about their needs. You don't just care about your own needs. This is a very self-absorbed...
selfish type of thing.
Well, all addictions are self-absorbed. They're all about filling the pain and the emptiness that's within us that should be filled in healthier ways. You know, we should really fill them. You know what the core of this addiction and all addictions really is a low or no self-esteem. A very battered self-esteem.
How about that person that's addicted or loves the actress, oh my God, Jodie Foster?
I don't know about
something. Oh, there was
I don't know about her.
Was
but Halle Berry,
okay.
They talk a lot about that. She's in and out of relationships. She was in a relationship where she was battered, For, you would think Halle Berry is one of the most beautiful women in the world. Here's a perfect example
Yeah.
how this addiction has no specific signs to it. A beautiful woman, successful, talented, and yet is with a man who's abusing her. It makes
How
no
about
sense.
Whitney Houston and Bobby Brown?
I think Whitney Houston died. Now, I'm going to stretch this. We might get some negative comments on YouTube from this, but I think she died of love addiction, which was the underneath core of her drug addiction. She got involved with Bobby Brown. She said it herself on an interview from Oprah. She couldn't get away from him. She couldn't leave. She prayed to God and prayed, and that's
an addiction.
She couldn't get away from him,
Yeah,
exactly.
that's an
So, and
addiction.
she was addicted to the drugs. Here was one of the most talented women of our century, and I think the root of the drug addiction really was love addiction.
You mentioned before quite a bit about the drugs and alcohol being like that kind of addiction. But
It's exactly the
So
same.
you're saying that basically it is the same.
It's the same. I mean, heroin will kill you. This addiction will kill you. From your opening statement, people kill themselves. They'll kill other people. They kill their children. I had
That's
a
another one. The people
who kill their children.
Yeah.
I actually was working with a woman, treating her with this addiction, and she had thought many times about killing her children because her boyfriend didn't like them.
Wow.
Thank God she didn't do that.
Yeah.
But even the thought, when a thought like this crosses your mind, you see the huge level of insanity.
You'd like to think. I mean, I would like to think that there aren't that many people out there, but we've seen some of them hit the air.
I
People
think
who usually kill somebody.
4% of the population has a love addiction. I think that's what the studies that I looked up.
Sounds
yeah.
like a pretty big number.
That's a lot of people.
It's kind of dangerous, yeah.
Yeah, it's a lot of people that we're not aware of. We hear about it, we joke about it. Oh, love addiction. Can you find me someone who has love addiction? That might work for me. You're talking to one of your friends, and people think, wow, what could be so wrong with that? But it's very wrong. It's very wrong because any addiction is wrong. Any addiction is addictive thinking. It's not healthy thinking. But there's hope. There's a lot of hope. I don't know if you're ready for that point of the program for me to talk about recovery in 12 steps.
Not yet. I was going to ask about the love addiction could be two-sided. It sounds not as if because of one person's fantasy, it may just be maybe two-sided. That's the question.
What do you mean by two-sided?
Well, the question reads, I was going to ask if love addiction could be two-sided, but it sounds as if not because it is one person's fantasy. Maybe the question's a little...
Well, a
awkward.
love addict could get into another relationship with someone also has a love addiction as well, and that's possible if that's what you mean, yeah.
Well, let's go to another question because that is an awkward question. Does love addiction require an intervention?
Sure. Absolutely. I mean, it depends, again, like all addictions, the level of severity. You have a lot of people who are alcoholics and they're functioning, quote unquote. They're going to work, they're doing the job, they're paying the bills, and they come home and then they're intoxicated. I can give you a myriad of reasons. But an addiction is defined as an addiction when it creates a problem in your life, all right? So when this creates a problem in your life, like all addictions will eventually. But yeah, there are different levels. Some people need medication. Some people need to be in a hospital. There are psychiatric breaks. They have nervous breakdowns. And then there are mild cases, again, of people working and doing what they call drive-bys. Are you familiar with that? That's all part of the love addiction lingo, where they're obsessed with someone. Either they've already dated them, or they're still dating them, or they were dating them. In any event, they go and they sit outside their house for hours to see nothing. Really, there's nothing that
So
they're going
kind of
to know.
they're so
But
attached.
it's the disconnect from your normal behaviors. Like, what would you really find by sitting outside someone's house?
What someone might be doing.
Doing, not doing, but if they're in for the night, you don't know. The point is, it's irrational behavior,
Yeah.
and it's acting out. It's an acting out, just like someone who's saying they're going to quit smoking and go and they hide behind the house and they smoke cigarettes. It's an acting out, and they're also ashamed of the behaviors too. It's part of the addiction. They don't want anyone to know they're there.
Is there a treatment for this, or is there some kind of program that can be worked with?
Yeah, there are treatments. Again, I believe that the 12-step programs for recovery, they've worked great with substance abuse and eating disorders, and they do work very well. There are 12-step programs for recovery for love addiction, definitely codependent workshops and programs like this as well. It's related to codependency as well.
Would you say that there are levels of this
Oh, sure.
malady?
Yes, there are levels.
Certain people probably are more visible than others.
Yeah. Like I said, you can, go to work, come home, and then sit outside your boyfriend's house, and that would be a level. There's a level where people have had to get orders of protection. You hear about that all the time, and yet they violate the order of protection and they get arrested. And then they have that kind of intervention. The legal system gets involved. Psychiatric, there's medications that treat antidepressants, anti-anxiety, all this kind of thing. But a huge program is a spiritual program. Again, the first step in recovery is that you're powerless over this addiction. And if indeed you are powerless, there's a power second step that restores you to sanity. And that's a program that's involved with God and allowing God to remove what you can't do for yourself. That's the 12 steps. I don't know if you're aware of this.
There's 12 steps
it's based
for
on the
alcohol
Bible.
and stuff like
It's
that.
Bill W. created it, I believe in 1939, and it was based on the Word of God, on the Bible. And then through the years, it's become modified to more of a spiritual program. But yeah, it was taken right from the Bible.
Do you experience any, or does anybody that you know of experience these tendencies, and yet you wouldn't consider that they would fall into this category of love-addicted personality? Have you seen, maybe got confused by some of these things, or would the public be able to recognize a person who's love-addicted?
Sure. I mean,
Junkie public?
if you've ever been at a party with someone or out to dinner with someone and they're constantly checking their phone, I mean, that could be a symptom.
That could be a lot of people.
Well, if
now.
there's no emergency going on in their life, but you find that within 5 minutes of your time, they're constantly checking text messages, their phone, waiting for a message from...
This is scary because I see people do this all the time.
Yeah, well, you don't really know the dynamics, but let's say someone's in a relationship with
things where
someone.
you don't know.
You don't know. But there's no reasonable reason, unless you have an emergency or a crisis going on in your life, where you really need to check your phone every 5 minutes. I mean, there's really no reason for that.
I hope that they're playing games.
No, I'm saying if you're in a conversation with them.
Yeah.
If you're talking to someone and every minute they're
I
checking
see.
their phone,
I see.
that might be
That's
a sign
different. I
that
see
they are
what you mean.
obsessed and waiting for a call.
Now I got it.
And you know what this does? These messages, and our system now, our high-level technology actually feeds into this addiction. Because there was a day when there was just a home phone.
Right.
Either you were home to get the call or you weren't. Now, every second you can be involved with your addiction with text messages. And sometimes there's no cutoff, there's no limit. Tweeting and whatever,
Yeah, you can-
Facebook.
instantaneous connection to people is
Yeah,
incredible.
and it feeds into the obsessiveness
Would have
of
thought
it all.
we'd have been there.
Yeah.
Is it widely recognized in the psychological profession or in other?
Well, yes and no. I'm not sure if they call it love addiction, or they may go into some other terms of hysteria or panic disorder or obsessive compulsive disorder. I don't know if that many traditional therapists are aware of the addictive quality that someone could attach to a person like they could with a substance. So more now than there were before, but not as many as there should be.
What else might there be to know about this that you can think of other than what maybe I've already asked or haven't asked?
Well, what I wanted to talk about was the partners that these people may pick. Because there is no self-esteem and or low self-esteem, whoever seems to come into this person's life is good enough for them. You know what I mean? Like, if we have good self-esteem, we want to pick a partner who we feel would be right for us, would offer us things that would make us feel good about ourselves. Someone who's an addict, they're happy just to get the attention, to feed into who they are and to feed into validating them. The validation that they didn't get when they were children is here. So here someone comes in their life that may be not on their level of education, on their level of economic level, or doesn't even treat them well. I mean, many people that are in addictive relationships are involved with narcissists. Now, we did a show back many months ago that was very successful on narcissism. Many people that have addictions, love addictions, are involved with narcissists, sociopaths.
You mean they just align themselves up to that type of personality?
Well, yeah. Well, water attracts equal level. You know, if you're not healthy, how healthy can you find someone? So you're going to find someone also has other issues that are also not dealing with a healthy level of emotional state. So yeah, so that person with the addiction is going to find someone who is so difficult to deal with, and also they set themselves up for pain, because an addiction always causes pain. No addiction, unless it's healed or dealt with in recovery, is ever going to serve you in a positive manner. The same thing with love addiction. They're going to be hurt by their partners unless they work on themselves.
Love-addicted personalities, according to some of the writing I've been looking at, there's denial and obsessions are
Yes,
some of the
denial. Well,
characteristics.
what's denial, Chris? Denial is a coping mechanism. When we're in denial about anything, it's a way to cope. So the person that has the addiction, the love addiction, is going to say, no, I'm just in love. I'm not addicted. You know what it's like. I love this person so much. I always
So you
want to
might
be with
see
them.
you might see weak excuses then.
Yeah,
them,
yeah.
possibly.
You know what it is? It's like any addiction. When the addiction becomes a problem in your life, when you're not able to function, do your other tasks, your work, taking care of yourself, your household duties, so on and so forth, it becomes a problem in your life. You shouldn't need to be with your partner 24/7. You shouldn't need to be spying on them. You shouldn't need to be checking their phone
Might it be
to see their messages. And that's what people do with addiction. They will pick up the phone and go through all their text messages, their voicemail. They'll try to break into the email. I mean, these behaviors, they're not good behaviors. I mean, that's clear. But if you look behind the person who's striking out and doing them, this person's in an enormous amount of pain. They don't feel that they're acting out and doing behaviors that are wrong. They feel they're not thinking. That's the whole point. They're in addict thinking. I'm not sure if that's coming through clear, but there's rational thinking and there's addict thinking. Very much think of the person who picks up the cigarette who has emphysema.
My only problem
That's
with
addict
how you're
thinking.
describing it is not really a problem with disagreement in terms of understanding. Having an understanding issue
Which is
because
normal.
of the depth of,
Yeah.
I see a lot of the behaviors you're talking about in what I would consider to be non-addicted personalities. I don't know if I described that right, but somebody who might not fall into the category
Correct.
of a love-addicted personality.
Right. Again, there's a different level.
Oh, that-
There's different
back to
levels. You
that.
know, sometimes when we meet someone in the beginning phases, you meet someone, you're excited, you're interested, but you are able to go on with your living.
The dopey period.
Yeah, I mean, the period where your brain's not, you know, all those
Yeah.
endorphins are being released, and, you know, that's like being having a couple of glasses of wine or something.
Yeah.
But this goes on. But even still in that state, Chris, if you can't reach that person, let's say that were you, if you couldn't reach that person for a few hours, you wouldn't go sit outside their house, would you?
No, because I understand that. That's
Well, then, see, that's the
It's quite a
difference.
big
You're not going to
difference.
act on that. And, you know, you're not going to get up in the middle of the night and see if they're home and follow them. I mean, these are, you know, think of that fatal attraction. That is to the largest degree, and then you have other degrees,
Yeah.
like in all behaviors.
like the movie Fatal Attraction really
Exactly.
hit home when you described that before.
That's a love addiction.
Let's talk we only have a couple of minutes left about the neglect and abandonment issue, which is what your mentor on the subject, Pia Melody, had talked about, that not only make bad choices, but there's also some early childhood trauma. That's something that maybe we should all be conscious
Right.
of.
Well, there's an empty hole in that little child, you know, and all of us, no matter how old we are, there's a little child in us, you know, and that empty hole that was never filled in childhood, that what we need to do when we become, if and when we become healthy adults, is we need to learn how to fill that on our own, with spirituality, with God, with our own self-esteem, with counseling, with different treatments. So that's never filled, and that's what happens in childhood. You know, John Bradshaw says that all of us are dysfunctional, and the people that say they're not are in denial. So we all have greater or lesser degrees of dysfunction, and it just depends how it manifests. For this type of addiction, it manifests with a person, with having that person who we don't know, that fantasy of what we want them to be, fill that hole that was created as a child through abandonment and or neglect.
We just have about 30 seconds left.
Okey-doke.
Might there be a recommendation that might be available for someone who's suffering from this? There's a conscious ability to change their
Yeah,
behavior.
reach out. Don't stay silent. You're only as sick as your secrets, and we cannot heal what we don't reveal. So seek help, get in a 12-step program, go see a therapist, reach out, seek a spiritual program, go to God, pray. You know, don't keep it as a secret.
thank
That's
you.
when it becomes bad, when you isolate.
Thank you, Marla Matthews.
so welcome.
Great topic.
Thank
Great
you.
topic. Love addiction. Societal and political trends are rapidly breaking down the family that once was the cornerstone of our great American culture. At FIT, we know you cannot get this information on your own, so we'll bring it to you TV every single week, of course. My name is Chris DiMaggio. Thank you for watching FIT TV, and see you again next week.